So we are in a setting that's not quite psychiatrist clinic, right? We have an Ayurvedic tool here. We have something that looks complicated, but it looks like it's from an allopathic practice. And then there are kids' toys. So what's going on here, Doc?
Thank you, Sonalini. And you're absolutely right that what you see here is kind of in part encapsulates how we work with children in Buddhi Clinic. The logic and rationale is that it's not just about one type of symptom. For children, symptoms can be physical, symptoms can be psychological, symptoms can be cognitive, symptoms can be emotional, behavioral, symptoms can be social, symptoms can be sensory. So there are a number of ways in which children with developmental disabilities present. And what we do at Buddhi Clinic is blend conventional therapy, so occupational, neurodevelopmental therapy, speech therapy, psychological therapy. We blend with that a whole house of Ayurveda, Naturopathy and Yoga. In fact, we have a protocol for children with developmental disabilities that we have now tested on a fairly large number of children with a lot of success, where we simply use 3 treatments repeatedly over a period of time to improve attention, improve mental clarity, improve sleep, improve digestion, improve behavior. We also have various brain stimulation procedures that we can use on children. Transcranial direct current stimulation is one that we use quite a bit to help children. It can reduce anger outbursts, it can reduce anxiety. We have a protocol that improves speech, especially when we combine it with speech therapy. So in a sense, there's a lot we can do for the child when we have this integrative approach. And in this clinic, across 4 floors, we have 15 treatments, which not just children, but people across the lifespan can use. And we have spaces and professionals who are completely oriented to the care of the child as well.
You talked about 3 therapies that you use in your protocol. What are these 3 therapies?
So there is an Ayurvedic head and neck massage with medicated oil. It's called Shiro Abhyangam. There is mud packs that we use, where we use river mud as a pack on top of the abdomen. It helps settle the abdomen, relieves constipation, relieves irritable bowels, relieves frequent urination. And then, of course, we do something called reflexology, which is thought to relax the mind but also improve the circulation. And this is the holistic pack that we do for kids with developmental disabilities. Many of them respond extremely well. Of course, we tailor that. For example, a child with physical disabilities will have a lot of neurodevelopmental therapy. A child with speech difficulties will have speech therapy. A child with behavioral problems may get brain stimulation as well and work with the behavior therapist. All that, but there is this particular holistic combo. We've actually published action research, including a book on autism, on how we use this combination to treat children. We've used this in a special school inside the school itself, where we had a therapy ambulance parked, and we delivered these treatments to children as they attended the school. And we've learned a lot from all those experiences.